Today on Technology and Ethics, we are talking about gene therapy.
We'll be hearing the opinion of a researcher, an ethicist, and a person who is directly affected by a genetic disorder.
I'm here with Dr. John Jesperson, who has been involved in gene therapy research for years. Doctor, tell me, what exactly is gene therapy?
Well, gene therapy is a type of medicine which treats or even prevents diseases that are encoded in a cell's DNA.
My research works by introducing a viral or bacterial vector into the host chromosome, which changes the composition of protein that are created by the cell, ideally from disease to healthy.
Wow, that's interesting. What types of diseases can be treated with this that couldn't with conventional medicine?
Well, there's too many genetic disorders to name, but a couple that people would know of are Huntington's disease, sickle cell anemia, and cystic fibrosis, which is what the research I'm currently working on is in.
What are the risks of this research?
As with any medical research, there's always a risk for certain drawbacks. In terms of side effects, the full spectrum of possibilities is not yet known because it's a new technology. Some that are known, though, include infection from the vector, unwanted immune system reactions, and in extremely rare cases, tumor formation.
Now, I know you're a researcher, so the answer might be obvious, but this is technology and ethics. So I have to ask, where do you stand in terms of the moral and ethical ramifications of gene therapy?
Well, I think the potential of this technology really outweighs the drawbacks. With enough research, this technology is capable of helping people who were once thought to be untreatable.
But what are the ethical considerations of this type of therapy? For more, we interviewed Albert Holst, a bioethicist who studies the ethics of genetic treatments. Albert, we want to know why gene therapy is such a tricky topic in ethics.
Yeah, gene therapy has been a contentious issue in the past, partly due to religious beliefs. In general, religion has a split stance on gene therapy. Some say that we are playing God and that the sanctity of life means that we should not be changing people's DNA. But others argue that as good stewards of the earth, we are obligated to do what we can to treat people with diseases, so long as we are not harming them.
With that in mind, what constitutes a disease that can be treated with gene therapy?
That's still an area of debate. Diseases in which an adult's cellular DNA could be treated are less controversial than embryonic treatments. If you could treat cystic fibrosis, for example, on a genetic level, you would improve the quality of life of a large number of people. A utilitarian might see the overall benefit of this therapy as being beneficial to the advancement of society. Even this view can be challenged, as many are wary of overpopulation, and the longer people live, the more support we have to give as a society to those people.
What about the fetus? If the parents can choose to cure their child's albinism, will this be extended to other traits that give humans diversity, such as Down syndrome? Self-advocates for such diseases often don't consider themselves as having a disability, and would not change themselves if they could. In a future in which gene therapy is commonplace, there are concerns related to the stigmatization of those people with genetic disease who cannot or choose not to accept treatment.
The eugenics movement has been widely accepted as being invalid and harmful to humankind. But if we possess the ability to alter traits which would increase viability, certain groups would become marginalized and be at risk for discrimination and worse.
Next, we'll be hearing from Parker, the parent of an 8-year-old girl with cystic fibrosis. Parker, what's it like for your daughter living with cystic fibrosis, and how do you think gene therapy would affect her life?
Well, a day in the life of April, my daughter, is very difficult. Research into gene therapy is my only hope for my daughter's future. I can't think of any reason to be against it.
If you were offered a position for April to be in a clinical trial without fully knowing the side effects, what would you do?
I'd be hesitant to put April in an experimental trial. My daughter's life is worth more to me than the risk of a medicine that hasn't been fully explored yet. I do want to give my daughter the best chance at autonomy when the technology is safe.
As a society and as professionals, we need to first continue to educate and debate the pros and cons of new medical therapies as they are developed. We need to do this to maintain autonomy for ourselves and to choose the ethical way forward. Additionally, we need to keep developing safe pathways for access to therapy that are ethically reviewed and governmentally funded and supported to show the world the way forward. Support for individual choice needs to be balanced against the utilitarian concept of taking action to promote the greater good of humankind. Embryonic gene therapy needs to be carefully considered, and the introduction of genetic counselors to the care team of pregnant people should be implemented to mediate parental decisions.
Moving forward in this manner has many potential benefits and many potential undesirable outcomes. Too many, in fact, to talk about all of them on technology and ethics. But the main benefit we can expect from this course of action is a wild increase in the quality of life of many people while reducing the risks with properly funded research. In the long term, the implementation of gene therapy is capable of causing an extreme shift in the way the world works, for better or for worse, but approaching the problem with extreme attention to ethical detail can mitigate the risks.